Your second question is, how do we incentivize wellness? Well, the current system doesn't do a very good job of it, right? If you pay doctors to do things, and what they're doing is keeping patients well, they don't get paid afterwards. In our system, especially if insurance companies are going to have people for a long time and they're not going to be able to unload people onto Medicare once they get sick, you're going to see the incentives change dramatically. And let me give you a concrete example. In Israel in 1996, they implemented a system like ours. And I went there last December to look at the system and to interview a lot of people about it. And what happened is, early on, there was a lot of trading of patients. 5-7% of people changed plans every year. And then after about 3 or 4 years, that stopped. And right now, there's about 1% change each year. But that turns out to be a very important 1%. And it keeps all the health plans on their toes. First, it means they're keeping 99% of their patients for a long term. Suddenly, they have a huge incentive to keep them healthy because they're stuck with them if they get sick. They're going to have to pay for them. So suddenly, you have a very different incentive on the insurance company. But that 1% switching also turns out to be very important for them to keep quality high. Why? That 1% is pure profit. They don't have to add another doctor, not another hospital bed to deal with that 1%. And so losing that marginal patient, that's all profit. That's all off the bottom line. So they're very incentivized to keep people and to keep them happy. So I think this provides a very good structure for wellness, for prevention, but also for emphasizing quality by the health plans. Okay?
Dr. Emanuel, the last time in this country that we tried to make a major change in the healthcare delivery system and the cost system was probably about 15 years ago, maybe 14 years ago.
Right.
It was vigorously opposed by the insurance industry and also by the pharmaceutical industry. Your proposals are very different. They're very constructive in my judgment, but they are a change in the status quo. There's a certain amount of inertia. To what extent do you think the insurance companies, the pharmaceutical companies will oppose your proposals, or is there any way you can get them to support it?
Far be it from me to talk for the pharmaceutical industry or the insurance companies, but I do actually think that times have changed in two ways. First of all, neither of those groups are as publicly reputable as they were 15 years ago. I just think that's a fact. I don't think I'm making a value judgment. It's just a fact. The second is, I do think our plan is quite favorable, mainly to the big insurance companies. It's not favorable to the small mom-and-pop operations. The big insurance companies really do succeed under our plan. They stay in business. They're given a lot more, 47 million more people enter the system, and they have a big incentive to bring to bear their particular talents and expertise. So my actual personal view is that from the insurance company standpoint, this is actually a pretty good deal for them, and I think the big insurers, there may be a split in the insurance industry based upon our plan. Let me tell you a little secret. Is this broadcast? You said there are some people inside of pharma who actually look at our plan very favorably. You may not like them, and I have no idea, but there are a lot of smart people who work in pharma. Some of my closest friends work in pharma, people I trained with. They want to do the right thing. The current system doesn't necessarily provide them the right incentives. And I think they realize that the current situation is unstable. And they would like, one of the things businessmen hate more than anything else is uncertainty and risk. Our system provides a lot more certainty. They know what the game plan is. They know what the rules are. They know what they'll be rewarded for. So I think even inside that group, there is a lot of positive interest in what we have. They realize that the world is going to change, that the healthcare system is going to change. It can't continue like this. And our plan probably offers them the best of the options. So I'm actually not as worried as you might be about those two constituencies going forward. You want me to be quite honest? I think it's it's ideology, not practicality, that could be the Achilles heel of our thing. There are people who believe no matter what, government can't do it. And there's going to be the real enemy of this, because there is no way to reform the healthcare system without having some important role for government. And if you believe that government should do nothing, well, then you'll be against our plan, just like you're against every other government involvement. So I think that may be. But I think the mood in America is changing on that particular issue. We've seen it in the food industry. We've seen it in airlines, that people realize you do need some regulation to make sure the market works well, and you therefore do need government. And so I think that's going to be less of an important issue.
I'd like to thank you very much for your education today. I walked in the room 110% single payer, and now that I've heard your comments, I need a little clarification, but I think I'm with you.
Oh, good.
One is you explained that, but part of it went over my head, so if you could clarify that a little bit. Then I don't know if all this is hooked up or not. Who decides what's the right kind of, if I'm 90 years old and I need some esoteric service that costs an arm and a leg, who decides if I'm going to get it or not, or if you're going to let me die because I'm closer to death than the newborn who needs some kind of treatment? And three, in your mind, who do you see, or what kind of a person, I'm not asking you for a name unless you want to give it, what kind of a person runs a system like the one you're describing?
Okay, so go back to the first question, the VAT, the least controversial of your questions. So a value-added tax is a tax that gets added on into the price of goods and services. It is attached to things like food, clothing, buying your computers, buying electronics. It covers around 60% of the economy. Now, I'm not going to tell you how it's going to be structured, because in the back rooms of negotiation, Congress and all sorts of tax people are going to make that decision. If you look more generally at how to fund something as big as healthcare reform, there's a very short list of potential taxes you can use. Okay, let me just eliminate some of them for you. You know, in America, the only thing we're willing to tax voluntarily seems to be sin, mostly cigarette smoking, right? You can't get enough from cigarette taxes to fund even an expansion of health care to the uninsured in most states. It's a very small tax. You could do corporate taxes, but they're highly unpredictable, and corporations are great at evading them, and they're not very progressive. You can't really add much to the income tax in America, so you can't use that tax. And then you're left with two taxes, really, or three taxes you can use. You can use a payroll tax, probably the worst tax imaginable. You know, it's bad for employment, it's very regressive, so I don't recommend that. You could use an energy tax. Gasoline over $4 a gallon, the chance of an energy tax going in. So you're left with a VAT. And a lot of people took Economics 101 and their professor said a VAT is a regressive tax. Very, very superficial economics. Because you can't just look at a tax, you need to look at what the tax is buying for people. And the fact of the matter is that if we have a 10 or 15% VAT, the average family in America would spend about $4,000 in a VAT, and they would get a $12,000 insurance benefit for that expenditure. In addition, there would be three important financial benefits to people if we go to our system. First, a third of state government budgets now go to health care. They go to fund Medicaid, they go to fund S-CHIP, they go to fund insurance for state workers. Under our plan, that goes away. So suddenly state taxes drop substantially. That's one. Two, people who get insurance through their employer, they're going to get a pay raise. If your employer no longer has to provide you health insurance, they're going to raise your salary, right?